Green tea is a source of polyphenolic catechins, and a growing body of evidence shows the green tea catechins can slow brain aging by modulating the neural growth factors, regulating the cell signaling that's involved in inflammation and neuronal survival, and by reducing the accumulation of abnormal proteins. A review of 21 studies found that green tea can reduce anxiety, it can benefit memory and attention, and also enhance brain function. Chlorogenic acids are polyphenols and are found in coffee, and many studies have linked the chlorogenic acid consumption to better cognitive function and mood. In 38 healthy adults aged 50 to 69 years with subjective memory complaints, drinking a beverage that provided 300 milligrams of chlorogenic acid at bedtime for 16 weeks resulted in better cognitive performance and improved blood levels of proteins thought to be the markers of early Alzheimer's disease. Melatonin helps to regulate the circadian control center of the brain, and it promotes sleep. The circadian patterns and the nighttime melatonin production diminish with age, and this contributes to poor sleep and the consequent neurodegeneration. In older individuals, lower nighttime melatonin levels have been correlated with mild cognitive impairment and dementia. Animal studies suggest the melatonin can repair the circadian and sleep disturbance, and it can reduce the associated cognitive problems. Melatonin's potential to reduce neuroinflammation and neurodegeneration have also been noted in animal models of both Alzheimer's and vascular dementia. In a retrospective analysis of patients with mild cognitive impairment, the effects of melatonin on sleep, mood, and several tests of cognitive function was reported. The analysis compared the effects of standard medication with or without the addition of melatonin in doses of 3 to 24 milligrams at bedtime on a total of 96 patients. The participants were monitored for 15 to 60 months, and the results showed the melatonin-treated group had improved sleep, mood, and performed better on all tests of cognitive function. In a similarly designed retrospective analysis that was previously conducted by these researchers, 9 to 18 months of treatment with 3 to 9 milligrams of melatonin per night improved the performance on all but one cognitive test in patients with mild cognitive impairment. A randomized control trial in 139 elderly participants who were undergoing hip joint surgery found 1 milligram of melatonin taken before bed for 6 days, beginning 1 day before the surgery, prevented the post-operative cognitive decline. There was also improvement in sleep quality, fatigue, and general well-being when compared with the placebo. Clinical trials in Alzheimer's disease patients indicate the melatonin can improve sleep, reduce behavioral symptoms, and enhance some of the aspects of cognitive function. In a first-of-its-kind study, melatonin's effect on memory were compared with 2 of its metabolites. The study tested the interventions on mice using a novel object recognition task and an analysis of the melatonin and its metabolites in specific brain regions involved in the cognitive memory. It's important to note that the novel object recognition task is used on mice because they have an instinctive tendency to examine unfamiliar objects. Given the choice, young healthy mice will typically spend more time examining an unfamiliar object than a familiar one, and the results showed the melatonin and its metabolites produced a notable improvement in object recognition compared to controls. The most potent effect was observed in the older mice who received the metabolite AMK, as these mice indicated a recognition of the objects for up to 4 days. The study also showed the melatonin can accumulate along with its metabolites in the hippocampus and the parietal cortex. The long-chain omega-3 fatty acid DHA is a critical nutrient for brain health, and a deficiency can cause symptoms such as poor mood and cognitive dysfunction. DHA is found in high concentrations in neuronal cell membranes, where it plays an important structural role for maintaining the membrane fluidity. Preclinical research shows the DHA plus EPA, along with other omega-3 fatty acids from fish, can protect against amyloid plaque and neurofibrillary tangles, as well as prevent blockages and improve the blood flow in small vessels in the brain. Adequate omega-3 fatty acid status might be needed for proper use of B vitamins in the brain. In addition, the DHA has anti-inflammatory effects and is a precursor for neuroprotectin D1, a signaling molecule that's involved in neuronal growth and survival. A number of studies have noted there's a strong association between higher seafood intake or higher blood or dietary levels of omega-3 fatty acids and better cognitive function. One study in 2,622 older adults found those with the highest blood levels of long-chain omega-3 fatty acids, including EPA and DHA, had an 18% lower risk of unhealthy aging, defined as a chronic disease, physical or cognitive dysfunction, or death for any reason over a 13-year period. Results from other research indicates the ratio of omega-6 to omega-3 fatty acids might be an important factor affecting the brain structure and the cognitive function. A meta-analysis of 6 randomized control trials used doses ranging from 400 to 1,800 milligrams per day of combined omega-3 fatty acids for periods of 3 to 40 months, and it found omega-3 fatty acid supplements can slow the rate of cognitive decline in the elderly. Similarly, a large review of 24 studies found evidence that suggests a beneficial effect of omega-3 fatty acid intake on cognitive aging. However, the findings have been inconsistent. For example, 1,720 milligrams of DHA and 600 milligrams of EPA daily for 18 months had no effect on cognitive decline in 390 healthy older subjects, and in 99 participants with normal or mildly impaired cognitive function. 750 milligrams of DHA and 120 milligrams of EPA daily for 1 year also showed no significant effects. In a randomized placebo-controlled trial, 1,680 participants aged 70 and over with subjective memory complaints received either 800 milligrams DHA plus 225 milligrams EPA every day or a placebo for 3 years. Although DHA and EPA supplementation didn't affect the cognitive function in the initial analysis, a secondary analysis, including only those with a low baseline of omega-3 index, a measure of the omega-3 fatty acid in the red blood cells, showed the supplementation led to improved executive function in this group. Data from the same study suggest those with an omega-3 index of less than 5% have increased odds of cognitive decline and might benefit the most from the supplementation. Another factor that can influence the results from the clinical trials is the presence of the Apoe4 gene variant, as this has been associated with disrupted DHA metabolism. One study in 915 elderly participants only noted a link between higher seafood consumption and reduced cognitive decline in the Apoe4 carriers. In another study, an observed protective effect of the seafood consumption against amyloid plaque and neurofibrillary tangles was also found due solely to an effect in Apoe4 carriers. Because of such findings, it's been proposed the DHA supplementation might be more important in carriers of Apoe4. B vitamins are needed for homocysteine metabolism, and lower levels of B vitamins, particularly folate, B12 and B6, have been correlated with high homocysteine levels and greater cognitive decline in the elderly. While B vitamin supplementation has been shown to effectively lower high homocysteine levels, so far the results from clinical trials have been mixed with regards to cognitive benefit. Researchers have been investigating factors that identify those most likely to benefit from the treatment with the B vitamins, such as omega-3 fatty acid status, homocysteine level, or the degree of cognitive impairment. One randomized trial found the positive effect of the B vitamin supplementation on the cognitive function was dependent on sufficient omega-3 fatty acid status. A 2-year randomized control trial found supplementing with B6, B12 and folic acid slowed the cognitive decline only in those with baseline homocysteine levels that were 11 micromoles per litre or higher. Supplementing with folic acid and B12 was associated with a reduced risk of dementia during 5 years of monitoring in older adults with mild cognitive impairment. In older adults who are diagnosed with the mild cognitive impairment, 400 micrograms of folic acid per day reduced the cognitive decline, and it decreased the blood levels of inflammatory cytokines after 6 months and 1 year. Even after only 12 weeks, a supplement with B6, folic acid and B12 decreased the homocysteine levels, and it improved cognitive function and depression in a trial in participants with mild cognitive impairment. Another potentially important factor is the effect of the metal tetrahydrofolate reductase, or the MTHFR gene, and the carriers of a particular MTHFR variant have abnormal folate metabolism, and they require a higher intake of folic acid in order to avoid a deficiency. They might also benefit less from ordinary folic acid supplements. To overcome this obstacle, one preliminary study used a supplement with L-methylfolate, the active form of folate, and B12 as methylcobalamin, in patients with high homocysteine levels, and they found the treatment reduced the cognitive decline and was more effective in those with milder versus more severe cognitive dysfunction. Alpha-GPC, or alpha-glycerylphosphocholine, is a semi-synthetic derivative of the nutrient phosphatidylcholine, and is a precursor to the neurotransmitter acetylcholine. Acetylcholine is the major neurotransmitter in the autonomic nervous system, and its accelerated breakdown is thought to contribute to age-related cognitive decline and dementia. In fact, reduced concentrations of the acetylcholine metabolizing enzyme, acetylcholinesterase, has been observed in the brain of superagers. Acetylcholine precursors alone, or in conjunction with acetylcholinesterase inhibitor drugs, are a promising approach to dementia treatment. One randomized control trial compared the effects of 1,200 milligrams of alpha-glycerylphosphocholine daily for 180 days to a placebo in 261 patients with mild to moderate Alzheimer's disease. And those receiving the alpha-glycerylphosphocholine experienced improvements in cognitive function and behavioral assessments, while those who were receiving the placebo experienced no change or worsening of their clinical measures. In a preliminary trial in 50 subjects with mild cognitive impairment, 1,200 milligrams of the alpha-glycerylphosphocholine per day for 3 months resulted in the improved cognitive function. A follow-up evaluation performed 7 to 9 months after the end of the treatment found the cognitive function remained at a higher level than prior to the treatment. Another pilot trial found the alpha-glycerylphosphocholine had a beneficial effect on the cognitive function after 15 days of treatment in the patients who had experienced a stroke. Reports from an ongoing randomized control trial showed the combination treatment with the acetylcholinesterase inhibitor plus alpha-glycerylphosphocholine was more effective than the inhibitor plus a placebo for preserving the cognitive and behavioral function in patients with Alzheimer's disease and cerebrovascular injury after 1 year and 2 years, and there was reduced apathy, the loss of motivation associated with progressive dementia after 3 years. The most recent report from the trial showed the co-treatment with the two agents reduced Alzheimer's-related behavior and mood disorders. You can check out my video on huperzine A for a natural acetylcholinesterase inhibitor. It was also noted that when alpha-glycerylphosphocholine is combined with uridine monophosphate and DHA from fish oil, it increases the growth of neurons in the brain. The brain has a high concentration of phosphatidylserine, a phospholipid that incorporates 2 fatty acids and is part of cell membrane and myelin. Phosphatidylserine is necessary for all aspects of cognitive function, as well as nervous system control over the motor function. Aging is associated with deterioration of brain structure and chemistry that can be affected by phosphatidylserine supplementation. Early clinical trials using phosphatidylserine extracted from bovine brain tissue showed promising cognitive benefit in elderly individuals. However, safety issues concerning the source of the phosphatidylserine led to its removal from the market. Phosphatidylserine can also be extracted from soybeans, and soybean phosphatidylserine at a dose of 300 mg per day has been shown in uncontrolled trials to improve cognitive performance in some older individuals with memory complaints. Bovine phosphatidylserine differs from soybean phosphatidylserine in its fatty acid profile. Bovine sourced contains the omega-3 fatty acid DHA, while soybean sourced doesn't. A marine sourced phosphatidylserine complex with omega-3 acids EPA and DHA has been shown to be safe and to have positive effects on cognition in older adults. In an open trial in 8 volunteers, 60 years of age and older, with subjective memory complaints, 300 mg per day of phosphatidylserine with EPA and DHA for 6 weeks led to improved performance on a short-term memory test. A randomized control trial in 157 participants with subjective memory complaints compared the effects of 300 mg per day of marine phosphatidylserine to a placebo. At the end of 15 weeks, those who were receiving the phosphatidylserine performed better on a test of short-term memory, and the effect was strongest in those with the best baseline cognitive function. The trial continued for another 15 weeks, with all participants receiving 100 mg per day of phosphatidylserine supplement. Those who had already been receiving the supplement maintained their cognitive gains, and those who had been receiving the placebo showed improved cognitive function. For more on age-related cognitive decline, continue on the series, or for more on herbs, supplements and natural treatment plans, check out my website.